Still on health matters, speakers at the Multi-Sectoral Forum on Epidemic Preparedness and Response Financing in Nigeria want government at all levels to improve budgetary allocation to the healthcare sector. This, they say, will help in improving its epidemic preparedness and response, as well as provide basic healthcare delivery for Nigerians. Helen Osamide-Akins reports.
The state of Nigeria's healthcare system is still a far cry from what is found in developed countries. The ongoing COVID-19 pandemic has further stretched the country's health security infrastructure and exposed its suboptimal capacity to cope in the face of epidemic and pandemic. Although the country has taken several steps to improve its capacity to prevent and respond to major outbreaks, its public health infrastructure is still filled with many gaps. Some of its challenges include an insufficient legal framework for epidemic preparedness and response and poor funding. This forum on epidemic preparedness and response financing in Nigeria has brought together stakeholders to deliberate on how the country can raise the accountability bar for health security financing. The speakers stressed the need for improved funding for the sector and why it is important for partners to continue to dialogue with government authorities to ensure accountability in the health sector.
We must strengthen our health system. We must ensure that we have more money into the health sector. We must ensure judicious utilization of funds within the health sector. Today, as it is, the generality people have mistrust, are not really confident about what is really happening.
If you look at all the benchmarks, we are looking at 15% allocation of government expenditure. We are doing like 4 to 5% in a year. We are looking at another benchmark of 1% of the GDP spent on health. 5% of GDP spent on health. In Nigeria, we are doing less than 1. Another benchmark, we are looking at $86 spent per person on health. And Nigeria is doing around $12, $13 or thereabouts. So in terms of benchmarks, we are not there. But we have the opinion that it's very important for us to continue to engage and change the narrative, not just to say health as a mere expenditure.
In April 2001, the African Union countries pledged to set a target of allocating at least 15% of their annual budget to improving the health sector and urged donor countries to scale up support. Several years later, many countries are yet to reach the targets. A breakdown of the 2021 budget shows that only 4.52% of the 13.082 trillion naira was allocated to the health sector, despite the ongoing COVID-19 challenges. Helen Osamide-Akins, TVC News.